I'm here with Bonny Specker, epidemiologist, who is going to give us a COVID-19 situation update on what's been happening in our region, across the state, in the nation, and in the world with COVID-19. And she's also going to give us an update today on COVID-19 variants and what that means to the COVID-19 situation as well. So Bonny, what do you have for us today?
Thanks, Chelsea. Before we get into the presentation, I just wanted to note this came out this morning in the Washington Post. We have hit another milestone where 1 in 500 Americans have now died of COVID. I just thought that was interesting. It kind of puts the numbers a little bit more in perspective. We've talked about, people's inability to comprehend large numbers. And I think when you put it in these terms, it conveys the message a little bit more than just having these massive numbers. I did want to talk a little bit about the variants, and this picture I thought was kind of nice. It's from the CDC website where they discuss this, and I have all the websites here that these slides are taken from. But one of the things that particular website talks about is how do you understand variants? And it's important to realize that the viruses are constantly changing, they are mutating, and these mutations are what the variants are. And these variants can either disappear or they can persist. And they compare it to a growing tree with different branches, and that these branches are what makes the different variants of this virus different. And they can compare these branches to find out what is different about this virus. And the more the virus spreads, the more chances it has to change. So every time there's a new virus that comes into being, there's a chance that it's going to mutate. And that's true with cells too. It's a biological phenomenon. But changes can be monitored by comparing physical traits of these different variances. And some of the things they look at is the ability to spread, the resistance to vaccines or different therapeutic treatments, and also the actual genetic code that gives you that mutation. And looking at those different things, scientists can often predict if a certain variant is going to be more dangerous than other ones. And the CDC and also the WHO, the World Health Organization, classifies variants into 3 groups. And what the CDC defines as variants of interest, how they define it's the same, but the different variants may not be the same, and that'll come up a little bit later. But you have variants of interest, and these are ones that have genetic markers that predict that the transmission diagnostic methods, the PCR testing, for instance, and treatments, or whether this virus or variant can escape the immunity that you might have from infection or vaccine. They wouldn't be effective. And they also are variants where there's evidence that it's causing an increase in cases. Okay, so if there's a variant out there that may predict, may be able to avoid the vaccine or the immunity, if it's not increasing, it's not going to be a variant of interest. And these variants of interest also have limited expression in the United States. So if you're not seeing it, they might put it in that group. Now, variants of concern, this is where the more recent variants have been that we've heard about, that the Alpha variant earlier in the summer, and then now the Delta variant. These are ones that have evidence of impact of either affecting the diagnosis of having the virus, the treatments that you use, or the immune escape, that ability to avoid the vaccine. And they also have evidence of increased ability to spread and disease severity. There is another category that hasn't been used yet, and these are variants of high consequence. And these are ones that can actually avoid being detected by the current methods that are used. And that there's a significant reduction in effectiveness of vaccines and treatments, and that you see more severe clinical disease and increased hospitalizations. Fortunately, we don't have any of those. Now, the Delta variant, this is just a summary of why it's a variant of concern. It does spread much faster than the other variants. We've talked about that for the last several videos. There is some evidence that it may cause more severe cases than other variants. And the vaccine, the infections happen in only a small proportion of the people that are fully vaccinated, but those fully vaccinated people can spread this Delta variant to others. And right now, it looks like all vaccines are effective against this Delta variant, at least in terms of severe illness, hospitalization, and death. And it does also have an impact on the therapeutic treatments that are available. There are certain monoclonal antibodies that are less effective against the Delta variant. Now we have this mu variant, and this has been in the news recently, and it is now classified as a variant of interest by the World Health Organization as of August 30th. It is not classified yet by the CDC as a variant of interest. The WHO classified it because it has the potential properties of immune escape, but that needs to be confirmed in humans. This potential property of immune escape, essentially what they took is this variant and they put it in like a Petri dish. So it's all done in the lab. And they found that the neutralizing antibodies, you know, that someone may have if they've been vaccinated or previously had COVID, are not very effective in the lab against this variant. But that can happen, but you can still have other types of immune response that might be effective. So it's not really been confirmed that this mu variant escapes the immune system in humans. It's only been shown in the lab. Globally, the prevalence of this variant has declined, and the CDC currently isn't considering an immediate threat because it's like 0.3% of the variants that they have detected are this mu variant, but they are watching it, and we may hear more about that later. But as of now, the CDC isn't considering it a threat. One of the other things I wanted to briefly mention, this slide comes from a talk we did back in June, the end of June, is coming up with the number of susceptibles. And we can do that, you know, ideally if we had the number of people who are fully vaccinated, that's who has immunity against this Delta variant. And then if we look at people that have been previously infected, you know, there's going to be some overlap. People that have tested positive are still encouraged to be vaccinated. But we don't know these numbers. But we do have numbers. We have the number of people that have received at least one vaccine, which is not really going to be effective as with the Delta variant. You need to be fully vaccinated. But at least it gives us an estimate of vaccination rates. And we also know the number that have previously tested positive. And that's going to be an underestimate because there's a lot of people who probably have been infected that were never diagnosed. But based on these informations, we can get kind of some idea of the numbers of people that are susceptible. And I just calculated that. We did this back in June, and this was the percent of the county populations, the percent of the population that was actually susceptible to COVID or the SARS-CoV-2 virus. And I had noted in that talk the three top counties were Pennington, Lawrence, and Brookings, having the highest percent of their population that was susceptible. The way I calculate this is I look at those numbers, or the percent receiving at least one vaccine, and I add on to that the percent testing positive. So this 47 plus 17 is going to give me an estimate of the percentage of the population that's immune. So I add those two together and subtract it from 100, and that's the percent that's that's the percent that's susceptible. So I redid that using yesterday's data, and you can see that a lot of these counties have a less percent of their population that's now susceptible over the last 3 months. Brookings, for instance, back at the end of June, 45% of our population was susceptible. Now we're down to 40%. Now you can look here, you know, Pennington and Lawrence have had a lot of cases this last month, and they've really dropped from, for instance, Pennington, 53% of their population was susceptible at the end of June. That's now down to 44%. But I think an interesting thing is to look at the number of people that are actually susceptible, because you know, people say, well, is this almost over? Well, this number of people that are susceptible are still ones that can be infected. And because this variant has such a high transmissibility, this is going to be kind of how many people are out there that can still be infected. Now, issues that aren't taken into account in these numbers, we don't have, like I mentioned in the previous slide, the percent that's overlapping. We don't have the number who were infected that were asymptomatic, but we also, and that would actually decrease the percent susceptible, but if they weren't that sick, it's likely they didn't build up a strong immunity that has persisted for the last year and a half, which is the waning immunity issue. So that kind of counterbalances it. And we don't have the fully vaccinated. We just have here the percent receiving one or more vaccines. Now, if you remember Pennington and Lawrence, this graph starts the beginning of August. You know, back here, Pennington and Lawrence were looking just like every other county in South Dakota. And now they were the ones that had the largest percent of their population susceptible. And you can see that in mid-August, they really skyrocketed. And I think that's a combination of having a high percent susceptible on top of Sturgis and other things. You know, they had a lot of people, just tourism coming in, you know, potentially bringing that virus, and with a large number of susceptible people, you're going to see increases in the cases. Brookings, on the other hand, we've managed to stay kind of down, at least compared to Pennington and Lawrence, but we are in a level of high spread, and we are one of the highest counties. You know, Davison, they have a much lower percent of susceptible of their population that's susceptible, so they're likely to sort of slow down before Brookings. So now, as far as the weekly summary, you can see in Brookings it was not a good week. We are definitely trending quite high. We almost doubled our number of cases last week. We had 126 cases diagnosed in the previous week compared to 70 the week before. And if you look at the age distribution, 40% of those 126 cases were less than 20 years of age. So it's, and then another 35% were between 20 and 39. So 75% of the cases in Brookings last week were under the age of 40. 16% were in that 40 to 59, and 9% were in that 60 years and older. So it's spreading, and it's spreading among the susceptibles. These are the age groups with the lowest vaccination rates. If you look at hospitalizations, we lucked out. We had no hospitalizations last week compared to 2 the week before, but you can see that hospitalizations are, these are small numbers, so they're kind of bounce around a lot, but we're back to where we were maybe the end of September last year, early this spring. No deaths. We haven't had a death for quite a while. Okay, as far as South Dakota, it's still increasing and we're in a high spread. The test positivity was 16%. We have 30% of the cases in the state were among people less than 20 years of age, and 29% were between 20 and 39. So Brookings has 75% of their population in that less than 40 group. The state only has 59%. So Brookings' younger population is getting hit a little bit harder than the state. If you look at the state data, that's this here. These are the numbers of total cases. The K-12 students from across the state is increasing quite substantially. 50% increase roughly last week. We have 963 K-12 students. The K-12 staff is also increasing pretty well, but with 229 cases as of, I think this is September 11th. The higher ed students, 153, and higher ed staff, 57. One thing to remember is that the K-12 data is reported to the schools by the Department of Education. So the Department of Health reports those numbers when they're actually diagnosed, whereas the higher ed data is self-reported. They're relying on people to report that. If you look at Brookings specifically, last week we had, or as of yesterday, we had 17 active cases, and that compares to 5 on September 8th. If you look at SDSU, on September 8th, there were 40 active cases, and as of yesterday, there were 27. Statewide, if you look at hospitalization rates, this is kind of nice to see, and we'll see if it stays that way. But this purple line's the new admissions per week. That's down just a little bit. We had 124 new admissions last week compared to 141 the week before. And currently hospitalized, we had 204 last week compared to 210 in the previous week. And the ICU admissions have also dropped from 60 to 58. If you look at the age distribution of who was admitted to hospitals last week, 3% were less than 20 years of age, 4 individuals. 14 were between 20 and 39, or 11%. 31 were between 40 and 59, and 75 were 60 years and older, or 61%. Now, part of the reason some of those hospitalization numbers could have dropped is that we had a doubling of deaths last week. We had 16 deaths in the state compared to 8 the week before. If you look at the age distribution of those deaths, 1 of them was between 20 and 39 years of age. 3 of them were between 40 and 59, and 12 of them were 60 years and older. So deaths are starting to increase now, which we expected because you have that delay. If you look at the United States, it's looking better. It's the decline that we saw last week is persisting, although it's quite slow, with about the same 1 million cases last week compared to 1 million the week before. If you look at deaths, those are still increasing. And again, this is probably because of that delay. We had over 13,000 deaths last week in the US compared to 11,000 the week before. And we have surpassed the number of deaths that we saw in the US during the 1918 influenza pandemic, which was about 675,000. Globally, it's looking pretty good. It's continuing to decline. There were 3.9 million cases last week compared to 4.2 the week before. But as you can see, we have a long way to go. We need to get down in this range. As far as deaths globally, there were this is also dropping in a kind of a nice straight line. There were 63,000 deaths last week compared to close to 66,000 deaths the week before. So we're at 4.66 million deaths globally. So just a reminder, be kind to yourself and others. You know, it's important to get vaccinated. And in addition to that, we need to, right now, because of this increase in the Delta variant, we need to use those other ways of trying to slow this down by masking, socially distancing, avoiding crowds, and practicing good hygiene. So that's it for this week.
Thank you, Bonnie. And I also wanted to let people know if you are experiencing symptoms, you know, it's good to go get tested for COVID-19, or if you've had an exposure, a direct exposure, even if you're not showing symptoms, you know, the CDC is recommending that individuals go get a COVID test with any kind of exposure. So I put together an infographic that is available through the City of Brookings website that just kind of breaks down all the places in Brookings where you can go get a COVID-19 test and information related to that, and all, you know, kind of how to go about that through those different places in town. So that is a resource that is now available to you. And, you know, make sure that you take care of yourself and stay healthy. Have a great week.